let's get started. First of all, welcome everyone to the New York State Bleeding Disorder Coalition Update webinar. Thank you all so much for joining. Just a couple of things before we get started. We are going to be recording this webinar, so if you would rather not be on camera, or feel free to take yourself off screen, but just wanted to let everyone know that we are going to record this and we'll be able to share so that folks that couldn't make it on today are able to access the content still. Just a few things. If you haven't already, please mute yourselves, just so that we don't get a lot of feedback or you know, other noises, things like that. And just to let everyone know, the slides will be posted, and we will be posting, like I said, the recording of the webinar. So no need to furiously take notes. I promise that we will share everything with you. So just to move forward, a little bit of introductions and the agenda. So my name is Lindsay Cox. I'm the Coalition Manager of the New York State Bleeding Disorders Coalition, and we'll just kind of round robin with some of our presenters this afternoon. Linda, would you like to go next?
You tell me to mute. Hi, I'm the Executive Director of Hemophilia Association of New York. Been working in insurance and Medicaid for many, many, many years, and hopefully I'll be able to share some information and a little bit of insight into some of the options during COVID-19. Thank you. Thank you, Lindsay, for arranging this, and Bob.
Thank you, Linda. Jessica?
Hi, I'm Jessica Wolf. I'm a licensed medical social worker at Western New York Blood Care. I'm going to talk to everyone today about managing stress and anxiety, especially during this pandemic. So thank you, Lindsay and Bob, for having me.
Absolutely. And Bob?
Oh, sure. Bob Graham, Public Policy Director of the Coalition, patient, and the guy who you see talking at these meetings a lot.
And NASA astronaut in the International Space Station at the moment. So as we go through this, if you have any questions, please save them for the end, or feel free to post them in the chat, and we will make sure to answer all questions at the end as we go through. So a couple of things that we're going to be covering today are unemployment and resources, insurance and Medicaid, stress, prior authorization, and an advocacy update, and a few calls to action that we have if you feel so obligated. So moving on to unemployment. So just a couple of things that I will be touching on. We've been conducting a survey through the New York State Bleeding Disorders Coalition, and there are actually a large amount of folks that have responded, letting us know that someone in their household, or perhaps themselves, has lost their job due to COVID-19. So something that we really wanted to mention and reinforce was about unemployment insurance and during the pandemic. As of March 2020, there was a new federal law that expanded unemployment insurance to include those self-employed gig workers, and provide an extra $600 to people, as well as 13 weeks of benefits from above of what your state mandates, which is great. So I do want to click on this just to show folks kind of how to apply. So this will take me here. And so this is the New York State Department of Labor site. This is the Pandemic Unemployment Assistance. And if we scroll down, you'll be able to see an overview of the Pandemic Employment Assistance federal program, which is great. And as you can see here, the best way to apply is online. So all you would have to do is click that, and it brings you right to a login page. You can create an account and log in, and then everything will be able to be streamlined through the website. So back to this, there we go. Also important to note, I know a lot of people have been trying to apply for unemployment insurance either over the phone or online, and have noted that especially very early on during the pandemic, everything was kind of overloaded. the best way to apply is online, and just keep trying the lines if you have questions over the phone or things like that. The state has also waived the 7-day waiting period for those out of work due to COVID-19, so that's very important to note. So you can apply immediately as soon as the guidelines apply to you. Something else that we wanted to highlight was that New York State has put out a notice to those that have applied for unemployment insurance to keep an eye out and to answer phone calls originating from the 518 area code, which is the Albany area code, because it's likely that the unemployment office is calling to confirm some information. So if you do end up applying for unemployment insurance and you're receiving several calls from the 518 area code, do pick those up, as they very well could be the unemployment office calling. There's also specific, if you have additional questions in regards to the federal pandemic unemployment assistance for freelancers, there's another website here that we wanted to provide as well. Some additional resources that we wanted to supply. One of the best resources that I've come across so far in my research is actually the HFA's COVID-19 resources page. So they have it pretty clearly up on their website, which is great. I think it's one of the first things that comes up if you go to hemophiliafed.org. And they have an immense list of resources, everything from medical news, statements and updates, FAQs regarding the bleeding disorder community, as well as financial assistance, whether it's through scholarships, through the national organizations, local chapters, the government otherwise, as well as some other patient links and steps to help walk you through some of these new confusing processes that you might have to go through. So this is something that is definitely incredibly helpful, and I highly recommend that community members take a look through. Something else that I also wanted to highlight, and I know that this is going out for more than just New York City folks, but the New York City Council has also culminated a large list of resources on their page that also apply to more than just New York City. So they have a whole long list of assistance for individuals. This is obviously more not as specific for folks in the bleeding disorder community, but they have everything from employment resources, food assistance, financial assistance, et cetera, et cetera. So another resource that I wanted to share with the community, as they do have a lot of great links here as well. Ooh. All right, and now moving on to Linda with insurance and Medicaid. Linda, you're muted.
Yeah. Okay. Whoop. And wait a minute. There we go. Okay. Sorry. Don't do this every day.
No problem.
Insurance and Medicaid. Basically, when you're worried about losing your job, that's the first thing. You're losing your source of income. But further down the road, you may be finding out that your insurance coverage for you and or your family has ceased. So some of the options, and I will go over each one individually. One is COBRA. The other one is the New York Insurance Exchange, also known as Obamacare, New York State Medicaid. And then I have a slide on the different types of assistance that may help you if you find that your budget is still very stretched. Okay, next slide. Good. First one is COBRA, the Consolidated Omnibus Budget Reconciliation Act. Basically, this is coverage that's mandated by the government, and this applies to anyone who has had employer-provided insurance, unless their employer is a self-funded plan. They follow a different set of rules. But in this scenario, you would be eligible for up to 18 months of coverage, which is great because then you're not losing any of the plan benefits that you have had in the past. Unfortunately, you would have to pay the exact amount of premium that your employer had been paying, and that check would go to your employer. So this can prove to be extremely expensive. Some people will try it for a couple of months. And also, one thing that I'm hoping people that are laying off folks are considering is carrying their insurance for a couple of months as an act of benevolence. So hopefully that will be happening. And if someone is furloughed, usually they are not going to lose their benefits. Okay, next. The New York Insurance Exchange, as I said, I hate it when people call it Obamacare, but it is definitely its name. You would go to the New York State of Health link, and I have that up there. You enroll, set up an account. They ask you your demographics, where do you live, how many people are in your family, and what your income is. The one thing, if you are on unemployment, you have to count that as your income. So that's one thing to consider. So you can apply for coverage within 60 days of losing your coverage. And during COVID pandemic, anyone without insurance who thought they would just wing it and get by without insurance does have the opportunity to apply until June 15th of this year. When you do set up your account, then plans that are available in your area, and a lot of them are linked to, you know, the big guys, Aetna, Blue Cross Blue Shield, Empire, those present. There are choices. So basically you look at the options, try and pick the best fit for you and your family. Co-pays are discussed, deductibles are discussed, and premiums are listed. Everything is very transparent. And it is while you are on this website that you might find out you're eligible for subsidies, and that would be government credits that would lower your premium. And also you would find out if you were eligible for New York State Medicaid. Okay. And here's the website. Lindsay, did you want to go through this? Give a sample like you did before, or no?
Sure. Yeah, okay. I'm happy to. So I just kind of wanted to put this up here. I'm not sure why it's so low on the screen, but essentially this is the New York State of Health website. It's very, very straightforward. They have a bunch of very similar to the unemployment insurance website. You can go through, you can compare plans, estimated costs, and it walks you through a ton. They also have on the website a whole bunch of information, FAQs, how to apply. And then you can see enroll today is a big button that you can click, and it'll take you right through the process. So just wanted to put it up here that this is what the New York State of Health website looks like, and that this is where you would go to apply.
Great, thank you. Okay, New York State Medicaid is a state-run plan. It does depend on government funds and local funds. And the social worker at your HTC or whomever is providing your care, if there is a social worker there, would be able to steer you toward New York State Medicaid plans, as well as the insurance exchange could steer you into New York State Medicaid. There is little or no premium for Medicaid plans. I've heard of people paying a couple of dollars for specific items, but doctor visits factor, all other services are covered. There may be some limitations, and some services do require authorizations. I know we've been working for years trying to get a uniform authorization form between these plans. Right now, New York State Medicaid utilizes a managed care model, and that means that they are contracting with insurance companies in the area. That's why where you live is very important. And these insurance companies basically tell Medicaid, you pay us, or they make a deal, contractual agreement, you pay us and we will take care of the patients applying, getting insurance through us, and we'll manage everything. We manage the claims, the authorizations. Sometimes things are carved out to be paid by Medicaid. But most of the New York State managed care Medicaid organizations are familiar with bleeding disorders. A lot of the HTCs have done some great outreach. So it's not as if they've never heard of Factor. It's a very comfortable model. The one thing I would say, if you were going through even the New York State Exchange or through Medicaid, you have to pick a product. You have to pick a provider. Make sure that you have spoken to whomever is treating you for your bleeding disorder, someone at your HTC or at your hematologist, and find out what insurance in this model they would accept, so there's not a problem. Okay, Lindsay? Chip, I have to throw this in here. Child Health Plus insurance is a Medicaid product that will meet the insurance needs of children under 18 years of age. And there is, again, little or no premium associated with this coverage. Now, family members, mom could have insurance, dad could have insurance, but maybe the kids are excluded from a plan. Child Health Plus insurance is a very economical option for families to consider. And some of the things that are available for premium assistance, PSI, Patient Services Incorporated, has been around for many years. It is a nonprofit premium and payment assistance foundation. I've posted their phone number and their website. They get donations from big corporations, and then they try to share them equitably among the different diseases that they work with. The Hemophilia Association of New York, in the 14 downstate counties, we have a financial assistance program, but we also have 2 new COVID emergency financial assistance programs that help families impacted by COVID up to $1,000 a month. We plan on keeping this going throughout the summer, and there's our number and website. And NORD, the National Organization of Rare Disorders, they have a specific program that people can apply for. When you go to their website, you would go down to COVID-19 Premium and Medical Relief Program. They do list all of the rare diseases. When I first went to this website, bleeding disorders did not have its own category. However, you would go to the Premium and Medical Relief Program and fill out an application. And one thing that I did fail to include, and it was like I knew I was leaving something out when Lindsay spoke about HFA. HFA is also an organization that does have assistance for people impacted by COVID-19. And basically take advantage of what the local organizations can provide for you. Take advantage of what HFA can do to get through this. We want to make sure that there is not only no chance that there'd be a discontinuation of good care and good prophylaxis and so forth, but it's very, very difficult to take care of yourself physically as well as mentally if you're not putting food on the table. When we first started doing our program, the first couple of families literally said that, their money stopped and they had no unemployment coming in at that moment, and they were putting food on their table. So, use all of the programs out there. That's why they're there. If they didn't want to help people through this situation, it wouldn't be there. There's no need to think, oh, I'll wait till it's really bad. Don't. Take advantage of this stuff. And there are, on the New York State Bleeding Disorders website, there's many, many other resources that Lindsay and Bob and the rest of us have compiled. So it's a very great resource. And thank you.
Fantastic. Thank you so much, Linda, for going through that. Now I'm going to turn it over to Jessica, who's going to talk a little bit about managing stress and anxiety.
Okay, so we can go right into the next slide. We'll just start it off. So basically the definition of stress. Stress is a normal response. It is a normal physical and psychological reaction to the demands of life when we have drastic changes and when we're met with uncertainty. Uncertainty really fuels the fire of stress and anxiety. So this whole pandemic, this whole crisis that we're really living through right now is basically all uncertain. There's this huge unforeseeable future. We're talking about reopening, what our new normal is going to be. All of that creates unease and unrest. It's important to note that everyone reacts and experiences stress in different ways. There is no model of this is what your stress should look like. And, you know, multiple challenges on a daily basis in a short amount of time, like living through a pandemic, can max out our coping skills. So it's important to know what your stress triggers are, what your coping skills are before you kind of get to a point of crisis, and when you really need to lean into your support system. Next slide. So monitoring your stress. Like I said in the last slide, everyone experiences stress differently. So these symptoms are not exclusive, because some people who have diagnosed anxiety disorders may not really even experience these. But, you know, it's important to note that these are good, you know, kind of warning signs of stress and mounting anxiety. If you're having abnormal or drastic changes, difficulty in sleeping and concentrating, anger and irritability, change in eating patterns and sleeping patterns, increased use of alcohol and drugs, panic attacks, these things are all indicators of stress. I will note that if you are, you know, experiencing any type of, like, you know, a drastic change in these where it's impacting your, you know, your functioning, and you have the inability to, you know, do your activities of daily living, that's a concern. That's when you really want to reach out for help. And if you have a pre-existing diagnosis of anxiety, panic disorders, if you have a history of trauma or PTSD, you know, that kind of puts you in more serious spot, because you can kind of, your anxiety can kind of escalate a lot quicker than others. And really monitoring your stress is understanding your personal threshold for stress, what you can take, what you're able to deal with. I always like to say we're kind of like one coping skill away from having like a, you know, a mental health crisis. So it's really making sure you know what those are. Next slide. Oh, next slide, Lindsay. Sorry. Okay. So how to cope with, oh, I'm sorry, go back. Okay. There we go. So how to cope with stress during COVID-19. This is just a small list, you know, but you can never have too many coping skills. So when I talk about coping skills, that's really like the thing or the task you can do to really help you focus and distract you from overthinking and from worrying. So sometimes people don't really know what coping skills are. It's kind of that thing you can do that you can rely on that's going to kind of take you away from that overwhelming feeling. The first one is to prevent information overload, which is kind of impossible right now because all we see is coronavirus. It's all over the news, it's all over social media, it's everywhere. So really trying to limit that information intake can help. You know, you might live with someone who could sit there and watch the news all day and they might not be affected by it, but, you know, for you, you might need to go leave the room, put on headphones, listen to a podcast, and kind of limit your time. So it's important to know that. And also watching and you know, paying attention to reliable sources like the CDC, the World Health Organization. There's so much misinformation and information out there. All of that confusion just kind of adds to our stress and anxiety. So making sure that the sources you're getting is factual, vetted information. The second thing on there is to find control, knowing the things you can control and letting go of what's out of control. And that's a lot easier said than done. I find it's really hard sometimes to let go of control, and you know, that can be a really hard thing to do. So it's really important to kind of maybe do small steps. I kind of gave an example previously of stepping away, taking a break from the news. That's something you can kind of control. Leaning into your support system. I can't say this enough, that social distancing does not mean social isolation. We really need to stay connected. As humans, we're social creatures. We like to communicate. We like to interact. So it's important that, you know, you're really checking in with family, with friends, with coworkers, finding online support groups, you know, making and fostering those meaningful relationships, but doing it in a very safe way. The next one is use what works for you. So all those examples I have listed are the typical go-to coping skills, but if those don't work for you, that's okay. You know, if writing in a journal, going for a walk, whatever kind of helps for that distraction and that thing that can kind of pull you away from being stressed out, do that as long as it's healthy. And routine. which is really hard right now to try to have a routine, especially if you're at home or working from home. I think the best place to start with is a sleeping pattern and trying to establish, you know, our sleep routine. We all know that sleep is super important to our physical and mental health. So trying to create a more tailored, you know, routine of sleep can help. And positivity, trying to find the positive, looking for the happy news stories, finding the bright spots, trying to spread positivity because it's contagious and we all need that right now. Next slide. So this is something I wanted to touch on. In my social work world, we're talking about this a lot, but I don't know in the public if this is really being discussed. We really should be talking about grief because we're all grieving. We're all experiencing a loss. You know, we're losing important aspects of our lives. We're, you know, our normal life seems like it's gone and we're having to adjust to this new normal and we don't know what the other new normal is going to look like. And people are dying. You know, there's a staggering amount of deaths of New Yorkers, Americans, people all over the world. And even though that might not be on the forefront of our mind, it weighs on us, and that you know, that creates a tension and it does weigh on our subconscious. And when we have that unresolved grief and complicated grief, it results in anxiety and depression. So when we internalize and when we minimize our loss and our feelings about things, you know, it just kind of creates this unsettled tension within us. And that can, you know, really just, again, create, you know, some mental health concerns. So it's important that we acknowledge our loss. It's important that we feel, you know, angry or sad that our trip is canceled, that we don't get to celebrate a birthday with a loved one. Those are important things, and we should feel those things and talk about those things. When we suppress those, it really isn't healthy. So I included the 5 stages of grief, which was it's a, you know, a theory written by Elizabeth Kubler-Ross. And I think if you ever want to know more information on this, you can just kind of Google her name or the stages of grief. There's a ton of information about this, and it kind of really helps you to understand the grieving process and how to kind of come to acceptance. And it adds some normalcy to what's going on. Next slide.
Because they're gonna, right, if you're pulling your HC.
So resources, if you are being treated for anxiety, panic disorder, PTSD, you have a history of trauma, now is a good time to kind of communicate with your therapist or counselor, doctor, keep them in the loop, make sure that they are available to you by phone, by telehealth if you need them in a crisis. If you yourself are feeling overwhelmed, hopeless, suicidal, you don't feel safe, this is the number for the National Suicide Prevention Lifeline, and this is the text. And if you also want to give this, you have this on your website or give this to anyone if you're in a chapter at HTC, that's a good resource to have. They can provide you with immediate crisis services, and that's a national number. Also calling 211, they can give you a list of local resources in your area. And almost all mental health agencies right now are doing telehealth and telemedicine and accepting new patients. And most importantly, reach out to your HTC and chapter. If you're having financial stress, we can help you. If you need a list of local mental health resources, that's what we're here for. If you need help paying for mental health services, we can help you with that. So definitely reach out to us and use us. Next slide. And these are just some online resources I pulled together. I think the CDC is a great resource, not only for coronavirus information, but they have a lot of things on managing stress, you know, living in cramped spaces with a bunch of people, social distancing, having to become a teacher overnight. And the last two are websites that I find helpful. Mentalhealth.net is primarily a site for dual diagnosis and addiction, but they have a section on stress reduction and management that I think is really great. They have lots of blogs and articles. Same thing with Very Well Mind, tons of articles and resources. So those are just some good tools. And if you really want any more, you can always reach out to me, reach out to your local chapter, HTC. Thank you.
Thank you so much. So appreciate it, Jessica. All right, moving forward, next on the docket, we've got Bob Graham. You're on mute, or you're muted.
Sorry, I used to hosting these things recently, so Anyways, prior authorization. I think most of the folks on the call are familiar with it. I see a couple of new faces though, so just to quickly touch base, prior authorization, it's an insurance company rule. It's a form of what they call utilization management. And these are just ways that the insurance company tries to control how much of the covered services that you use. Typically under a prior authorization, you're covered for a medication or your doctor is in network. However, before you get that medication or before you see that doctor, your insurance company may want additional paperwork. That paperwork is often required from the doctor's office or the pharmacy. We as patients don't always see when a prior auth is needed. So that's why it's sometimes a little confusing for patients when we talk about this. The thing to know most importantly about prior auth is even though it's a covered service or provider, your insurance company might still decide to not approve it because they feel that that visit or that particular fill of the medication isn't necessary. Next. Okay, so the argument insurance companies will give you for why they need prior authorization is typically that they use prior authorization to prevent fraud and abuse. Let's say you have a small surgical procedure on your knee for which they prescribe PT. The insurance company may fairly ask 6 months down the road, do you still need PT? Because it has happened where a doctor might prescribe something for you that you don't need, or that really isn't the best treatment for you in that particular case. Something that we're starting to see a lot of in bleeding disorders land in particular is insurance companies requiring a prior auth for every factor refill. I personally have this issue with my insurance plan. Anytime that I or Jeremy, who's on my insurance plan, want factor, the center has to file a prior auth request. For me, it's not a huge deal because I'm on demand. Jeremy's on Profi, so every month he gets his factor refilled. So every month the center has to do the paperwork and jump through the hoops to get the prior auth, to get the factor refilled for that month. So the argument that the coalition has been making to legislators is that there should be limits on when an insurance company can impose prior auth rules and that there should be limits on what those rules are. Next. Okay, next slide. Thank you. All right, so there is currently a bill up before the legislature, A3038. This bill was proposed last year. It's sponsored by Assemblyman Gottfried and Senator Breslin. It does a couple of things to create guardrails on the use of prior auth by insurance plans. The first thing is it requires the insurance plan to reply to an authorization request within 48 hours or 24 hours if the health of the patient is in jeopardy. The current time minimum is 72 hours or longer. So obviously we'd like to see that cut back. The next guardrail we want to put up is that the insurance company has to be able to point to a genuine medical study that suggests that it's reasonable to question this treatment or medication. And an insurance company can't just say, well, we don't feel like paying for a year of physical therapy. They have to do better. They have to give medical reasons for it. They can't just cite cost. The third and probably most important for our community at the moment is that a prior auth approval once given is good for the life of the prescription. Prescriptions are typically up to 1 year. So for example, if I get a script, I go to my clinic visit, they write my script for factor, I go to my insurance company, I get the prior approval, it's good for the year. So that if I have to fill 2, 3, 4 times during the year, the center doesn't have to keep jumping through the hoops and spending staff time to fill the paperwork to get me medication that we have already established that I need and should have. And the bill, if when passed, will cover any insurance plan purchased through the exchange and all Medicaid plans. So next slide. And just this is the status of the bill. It was, like I said, proposed 2019. It is currently supported by our coalition, MSBDC, which is the Medical Society for the State of New York. They actually helped push the creation of the bill. There are several sickle cell patient groups behind the bill and the MS Society as well. 2019, we almost got it through the Senate. Unfortunately, in the Assembly, we are, as so often happens with these bills, stuck in the Assembly Insurance Committee. And it was going to be our #1 ask at Albany Days this year. Next. Oh, yeah, that slide's been behaving funny. So wanted to let you know what's going on with the bill now. Obviously, the legislature has not been meeting for regular business. There's been talk that at some point this year they will reconvene to deal with the hundreds of bills that have been lingering before them. We don't know when that will be. There's some talk of June, potentially July. Nothing's definite now, just that they plan to meet at some point this year for business. When we know, we're obviously going to come back to folks to make our push for the bill. We have been in contact with the offices, and unfortunately, they don't know much more about the legislative schedule right now than we do. One thing, though, we have right now for people to do to help with this bill and a few of the other bills we're looking at is to tell us on this bill if you're having issues with prior auth. And the other thing is there's a couple of calls to action that we want to put out to the community, and we're going to put them up on Facebook and Twitter. We're also going to ask all the centers and chapters to share them with their patients. Next slide.
So speaking of calls to action, something that the New York State Bleeding Disorders Coalition is launching is a story collection project. And so this is something we're really excited about. We are thrilled to kick it off. And for those that have been following our storytelling or our data collection survey, this will also be, if you participate, you can enter to win a $50 Amazon gift card. So I don't know if I'll be able to click this link. No, I won't. So what I am going to do is show you all what this looks like. And so Bob has put together an outline for this form, and essentially all it does is just collect a little bit of your information. And if you have any bleeding disorder stories that you would be willing to share, prior authorization would be phenomenal. But if you've got something else going on with mail order or insurance issues, or if you want to just share a story about your ER experience or something in the world of bleeding disorders, feel free to, and please, fill out the form and share your story. It does not have to be long, but there is an opportunity to share here, and this will be all completely used for advocacy purposes. And there are some options below here of whether or not you'd like to be followed up with, or if there's anything else that we can do to help as the coalition.
Yeah,
so, yes.
Sorry, I was just going to add to the folks out there, just so you know, the Google survey is a starting point for collecting people's stories. We're not going to take things off that and then just start sharing them. Ideally, what we're going to do is we're going to go through, look at the stories, and then follow up with the people. 2 reasons. 1, to get more information from their story, see if possibly they're willing to appear in a video, if they'll agree to share it online. And 2, because we want specific express permission from them to share their stories and the way in which we're going to share their stories, just so you folks know that we're trying to be very mindful. You know, it's important to gather these stories because you folks all know how important sharing the stories are, but we also want to be very mindful of people's privacy.
Absolutely. So that's one way you can get involved, and that link will be, like Bob mentioned, shared on Facebook and Twitter, and a ton of the chapters and organizations will be sharing it as well. So that'll be open and available to participate in. The other thing that we wanted to share is that, and many people have filled this out already, which we are so appreciative of, the New York State Data Collection Survey. So something else that is really important with legislation and advocating for legislation is data. And that is something that hasn't been collected on a statewide basis for the bleeding disorder community in a while. So we have the survey out. It should take no more than about 10 minutes. And if you do participate, you have an opportunity to enter to win a $50 Amazon gift certificate as well. So it's pretty simple, basic demographic information, and it is completely anonymous. So you don't have to worry about it being tracked back to you or anything like that. But the more data that we can collect in terms of the statewide community, the better it is and the better positioned we are for advocacy going forward. And so that you can find, again, with your chapters or local organizations have been sharing out that information. And we also have it in Spanish now. So there's an English and a Spanish part, and it's pretty easy to click through, and the data itself is pretty straightforward. So we highly encourage folks to take that as an opportunity to participate. And finally, that ends the content that we have for you all today. I've been monitoring the chat, and it doesn't look like there are any questions, but I would welcome anyone that may have questions to unmute yourself and ask now. So I will open it up.
Lindsay, I just wanted to say to Linda's point earlier, Linda, under MRT2, one of the things that the state is supposed to be doing starting next year is moving the plans over to unified approval forms. They want to unify everything across all of the plans, applications, approvals, all of that. I'm not sure how long it'll take, but that is one of their goals under MRT2. It's one of the good things we got out of that deal.
Yeah, that's good. It's good to hear.
Fantastic. And while folks either post in the chat or unmute themselves for questions, we also just wanted to share, and I'll click the link afterwards, feel free to visit our public website, which is NYSBDcoalition.org. That's the New York State Bleeding Disorders Coalition's website, where we do post updates, legislative updates, as well as have a bunch of links and resources there. Get the news and follow us on Facebook at NYBD.org or on Twitter at NYBD.org. So again, I'll open it up for questions to see if anyone has any and give the opportunity there.
I have a question. Do we have a potential scheduled date for Albany Days next year? We want to share that date?
Great question. So we are and have been, as the coalition, I'm pulling it up as I say this, have been looking. We are hopefully going to be doing the date of March 20th to March 22nd,
Beautiful.
2021.
All right.
So I'll say that again, March 20th to 22nd, 2021. And that's tentative. The legislative schedule has not come out yet for next year. So tentatively mark your calendars if you are interested in coming. And yeah, great question. Right. We do have one chat. Oh, it was Bob with the MRT2. All right, well, that is all we have for you all. Thank you all so much for joining. If you have any other questions, feel free there's an information link or an email link on the New York State Coalition website. To close it out, I will click here and just show you all briefly the website so that you're familiar with it. If you have further questions, info@nysbdcoalition.org is the email address to contact. And thank you all so much for joining.
Oh, thank you for planning.
Thank you, Lindsay, and everybody.
Great job.
Thank you, Lindsay.
Absolutely. All right. Thanks so much. Have a great one, everyone.
All righty.
Yeah.
Bye-bye.
Bye-bye.